Welcome to the clinic. You are probably here looking for an alternative solution to your spinal condition. If you are looking for a practitioner who addresses the underlying cause of your spinal condition and uses a no stone unturned approach, then you are in the right place. We are able to help people avoid or lower their dependence on pain meds to manage their condition while restoring function back in their spine. We are excited to start our educational process with you. Please, if you can, do me a favor. Put your phone up during this educational process, take some notes, and a practitioner will be with you shortly. Let's get started. Are you happy with your spinal health and with the care that you get at your doctor? Well, you're supposed to be happy with it. That's what's supposed to happen when you go to the doctor. Chances are that you're suffering from back pain, stenosis, sciatica, or some other spinal condition. Statistically, 90% of spinal pain sufferers are relying on medications, injections, and even surgeries to manage their condition. How about a better question? What if we could offer you a better way to treat your spinal condition and improve your condition by 90 to 100% without drugs or surgery? Would you be interested in that? Of course you would. Here in this video, you see a human spine and spinal cord. In order for our brain to communicate with the rest of our body, it sends signals down the spinal cord and out to nerves which emerge between the vertebrae. In between the vertebrae and your spine are discs. The discs are supposed to be healthy and thick and protect and cushion those nerve canals that the nerves themselves emerge from to go to your muscles and organs. In the case of spinal stenosis, sciatica, or back pain, it can be a sign of breakdown to the spine, the disc space, and the spinal canals. Here we see that when spinal discs start to break down, the inside of the disc can actually protrude and compress the nerve root that's emerging from between the vertebrae. If the nerve root is compressed at the spine because of unhealthy discs, it can cause pain in the legs, arms, or even headaches. The same nerves that emerge from your spine to go to, for example, the muscles in your legs, also go to other organs. Those same nerves go to the digestive system, the reproductive organs, and the bladder as well. So compression of those nerve roots because of an unhealthy spine can actually lead to other health concerns besides just pain. Back pain is one of the most common and debilitating conditions in the United States. Up to 80% of Americans have experienced back pain at some point in their lives. Back pain, stenosis, or sciatica can occur at any age, but it's most common among middle-aged and older adults. Back pain is the second leading reason that people visit doctors' offices. Americans spend at least $50 billion each year on back pain treatments. We will be addressing all the underlying causes that are accelerating your degenerative condition. The spine does not naturally break down with age, even though some people think of it as a part of aging. Through our multifaceted approach, we will be leaving no stone unturned with your condition, making sure you're a good candidate for our program. Low back pain, stenosis, and sciatica are some of the leading chronic degenerative diseases in the U.S. Millions of dollars each year are spent on surgeries and medications. The problem we have with treating back pain is that we rely on drugs, surgeries, and injections to try to fix the problem. But these are all acute care approaches, which means emergency care. But low back pain, stenosis, and sciatica are chronic degenerative conditions, and as such, they require a systematic approach to correct. Are you tired of taking medications? We're not here to scare you out of taking your medications. There is a time and a place for medication. Our healthcare system is #1 in the world for bringing people back to life and for symptom management. But the thing it's not so good at is bringing people back to health, bringing them back to functioning fully near 100%. According to the World Health Organization, we rank last in health out of 37 countries. We want to educate you on the differences between symptom care and corrective care. This image is an artistic representation of the current medical standard of care. This picture comes from a veterans magazine, and an article that goes with it describes our typical medical standard of care here in the U.S. It talks about that we have an epidemic. We have a symptom care system, meaning for every symptom, what do we have for it? Well, that's right, we have a medication. We have created a system that is fundamentally a reactive system, not a proactive one, and it never looks at the underlying causes of our conditions. Instead, it covers up the symptoms with medications. The article also talks about how we're in a health crisis in the U.S. For those of you that keep up with the news, you can probably agree that people are getting sicker and sicker, while at the same time they have more resources around them to try to stay healthy. So why is that? The article also talks about how we have an insurance crisis. Our country's health is going in one direction, and the insurance coverage is going in another. We have been bombarded with chronic illnesses, and there is no medication, injection, or surgery that will correct a chronic condition. Our healthcare system originally was built off of the acute care model, which means if you got the flu, broke your arm, or had a near-death emergency, that's what our healthcare system is really good at, and that's what insurance is for. Now they're trying to force chronic conditions into this acute care model, and it's miserably failing. We have a saying in our office, if nothing changes, then nothing changes. Meaning, if we don't start doing something different, then we're going to get the same result over and over again. First, it starts with a medication. Then the pain gets worse, and then maybe we try adding another medication or increasing the dose. The underlying condition continues to get worse. We might go do some rehab, maybe get an injection here and there, until we're a candidate for surgery. Another scenario is that the medication makes the injury feel better temporarily, but mechanically, the condition isn't fixed, and it continues to get worse and worse and worse until it becomes a bigger problem down the line. Spinal degeneration is a chronic degenerative disease, which means it progresses. There are no medications, drugs, or surgeries that slow down spinal degeneration. If you're taking a medication, and you've been doing this for months, years, even decades, what could possibly change? The trends we're seeing are higher and higher dosages and increased failed back surgeries. You may be here because you're being proactive with your condition and trying to avoid this route altogether. Congratulations, if so. Now, we're not going to spend a lot of time on this because everybody knows that medications have side effects. We are not saying to stop taking your medications. For those of you out there who can't walk without them or can't stand the pain, can't function throughout the day, we certainly don't blame you for taking medications in order to go about living your life. Our job is simply to educate you and give you alternative options to recovery by addressing the underlying causes of your condition. For any medication you may be taking, you can simply go to WebMD, look up the drug, and be informed about any of the potential side effects of the prescribed drugs. Using them long-term is obviously never the ideal solution. A medication tricks your body into telling you that you feel better. This false representation allows your spine to continue getting worse and worse until you qualify for surgery. Again, there is a time and a place for medications, but it's never ideal in the long term. Your doctor cares about you just as much as we do, so it's not your doctor's fault. It's just the conventional healthcare system itself and the limited options it offers. Your long-term option is spinal surgery. There is a lot of overlap between what is treatable in our clinic and when an orthopedic surgeon clears a patient for surgery, meaning that we've had patients who have been told they needed surgery, and we were able to stabilize them back to daily function. You have to remember, most doctors have 1 to 2 tools in their tool belt to treat spinal conditions. Medications are the first step, and surgery is the next. Spinal surgeries have short and long-term complications. The average spinal surgery cost is $100,000 or more, and adding on 6 to 12 weeks of post-rehabilitation, which sometimes takes away time from work and your family. This is why we are so serious about spinal problems. Statistics show the far better option is to try to avoid surgery altogether. 74% of back surgeries fail in the long term. You have a 257% better chance of returning to your normal life if you avoid back surgery. There is a 41% increase in opiate dependency on those who have had back surgery. And in the last 10 years, deaths from painkillers have doubled. Even some back surgeons are now saying that surgery is an empty promise. This next video really shows our conventional medical approach to chronic conditions and how it's so mistaken.
The American healthcare system is badly broken.
The present system doesn't work, and it's going to take us down. We need a whole new kind of medicine.
We're in the grip of a very big industry, and it doesn't want to stop making money.
If I spend 5 minutes with you and then put in one of these stents, I'd probably get paid $1,500. $50. For me to spend 45 minutes with a patient to try to figure out what their true problem is, probably get paid $15. It's a completely irrational system.
We don't have a healthcare system in this country. We have a disease management system.
We're spending almost twice as much in America as any other country on earth, but our lifespan isn't even in the top 20.
30,000 Medicare recipients die each year from care they didn't need. That's the equivalent of a jumbo jet crashing every single week. If the aviation industry killed as many people, we'd be up in arms.
The administration pays you based on how many patients you see. All right, who's next? If you try and buck the system, someone says, what can we do to get your productivity up? I'm not interested in getting my productivity up. I'm interested in helping patients.
We're seeing the military just being a microcosm of the problems society's having.
Soldiers' use of prescription drugs has tripled in the past 5 years.
This medications I was on.
Only by accepting that the American healthcare system is badly broken will we be able to seek out the escape fires, the potential solutions. There are answers.
One company has figured out how to lower healthcare costs by more than 40%.
We provide incentives for people to engage in healthier behaviors.
The Army Surgeon General directed that we establish the Pain Management Task Force to take a look at alternatives to narcotics.
I was skeptical, so skeptical.
I've gotten a lot of inspiration, a different perspective. There's a different way of doing things that is possible.
If I think about what healthcare could be like, it would have a lot more care in it.
The healthcare system is unsustainable. We're really mortgaging the future. Not just the health of healthcare, we're talking about the health of the nation.
Let's switch directions for a minute. When we think about it, we treat our bodies worse than we would treat our car a lot of the time. Don't believe me? Okay, well, let me ask you a question. If you were driving in your car and the check engine light came on, what would you do? Well, exactly. You'd probably take it to the mechanic. Then they would pinpoint the internal problem and fix it, and the light would go off because the internal problem had been fixed. Pretty simple process, really. What if I were to tell you that the last time my check engine light came on, I drove my car to the mechanic and asked him to just reset the light for me so it didn't bother me anymore? Well, that doesn't make sense, does it? Yet this is exactly what we are doing with our pain when we take NSAIDs, pain pills, and injections so that the symptoms go away. The medications reset the natural pain response to go away until the medication wears off, then the pain comes back. By doing this, we never address the underlying cause of our condition. The mechanical problem continues to linger until we have a huge problem on our hands. This is just as if I were to reset my check engine light without fixing the problem or even put a Band-Aid over it. I may have fixed the symptom, but I didn't fix the underlying problem. This is a setup for further damage or even more severe injury down the road. So the next time you have back pain, burning pain in your feet or legs, sharp pains shooting down your legs, deep stabbing pain, when it feels like your back or legs are going to give out, or if you have to sit in certain positions just to get relief, and the next time you have your check engine light come on and you reach in your glove box and pull out a Band-Aid and put it over the light, what's going to happen? Well, the symptom is gone, but the internal problem will continue to grow some more, and then finally fail. This is what we do with our health. Like we said, there is a time and a place for medications. We have to work, enjoy life, but putting a bandage on back pain long-term will get you into a situation with a point of no return. This could mean not being able to walk, exercise, sleep, or it may even get so bad that it's not treatable, except for through the acute care conventional model with drugs, surgeries, and steroid injections. So, let's briefly talk about our spine. In a healthy spine, on the left, you want to have healthy spacing between the two bones by having a healthy disc. This allows the nerves to stay healthy and send out all the proper signals to your muscles and organs. When the spine starts to be compromised, as we start looking to the right, the disc in between the bones starts to be compressed, and eventually the bones start to degenerate. This ultimately affects the nerves in that area and whatever those nerves control. Symptoms can start in phase 2 and progress as we get to the final stage, which we want to avoid at all cost. Our bodies are complex, just like a sports car. In order for this car to operate, function, and win races, it needs a few things. 1 is proper alignment. 2 is proper fuel, filtration systems, oil, and oxygen flowing through the engine properly for everything to stay lubricated and moving. And the third thing it needs is the car has to have a strong frame with fully functional parts and no extra weight, wearing out the shocks, struts, and mechanics of the car. Our bodies and spine work exactly the same way, so that we're thriving in our health. Let's talk about the different parts that come together for proper healing. There are 3 components that need to be evaluated with your spine so we can give you optimal recommendations and results. The first is a structural component. This is the same as the car needing a strong frame and proper alignment to win races. Same with your spine. It has to have proper alignment and stability to withstand day-to-day stresses. The second component is a neurological component. This is the same as the car needing an effective engine, fuel pump system, and parts. Our bodies need all nerves functioning properly for them to operate correctly. Those nerves are controlling our muscles, tissues, and organs. And third is the metabolic component. This is the same as the car needing great fuel and oil to operate at optimal levels. The fuel we're feeding our body can make a huge difference with how much physical and chemical stress is on our spine. Each component is equally important when evaluating and treating spinal degeneration, sciatica, and stenosis. If you've been to other offices, chances are you did not get all 3 of these evaluated. Let me explain each of these components one by one. In most clinics, it usually starts and stops with the structural components. They take a couple of x-rays and look at what they see and say, you have spinal degeneration. Here's a prescription for the pain. Or we could do a cortisone injection for the pain, but you can only get 4 a year because they're not very good for you. You're not a candidate for surgery yet. We can send you to rehab until you are. As you can see on the left, we have a normal spine with spacing in between the bones. That spacing protects your spinal disc, in turn keeping pressure off the nerves and allowing your body to fully function properly. On the right, you see a spine with limited spacing between the bones, compromising the spinal disc in between. If you were to look at an MRI, on your far right, you will see a bulging disc from the compressed spine, putting pressure on the nerve. Through the lack of proper motion in the spine has started to break down and degenerate. Anything in between the image on the left and the right is degeneration and needs to be addressed. Structural changes in our posture and spinal instability will cause weight to be shifted to one side, putting unwanted stress on the spine. Once one area of the spine is compromised, all areas of the spine are compromised as well. When we have lower back problems, those lower back nerves that travel down to the supporting muscles of the knee get compressed, causing them to weaken, which will in turn cause the knee joint to collapse faster than normal as well. This can be a chain reaction between the lower back and the knee, causing multiple degenerative conditions to correct. As you can see, the neurological component in the lower back is very important. The important question is, have you received the proper evaluation for your spinal problem? You might be thinking, what does my metabolic health have to do with my spinal problem? Great question. It actually has a lot to do with your spinal problem. Let me explain. According to the Mayo Clinic, every pound of extra weight we carry is 4 pounds on the joint. So you can only imagine the stress on our joints if we're carrying an extra 10, 20, sometimes even 30 or more pounds. The Mayo Clinic attributes this as the leading cause of joint degeneration, including the spine and the knees. You may also be experiencing what's called leaky gut syndrome, hormonal imbalances, diabetes, heart disease, or thyroid issues. All of these come with a host of overlapping symptoms, such as bloating when you eat certain foods, constipation, diarrhea, fatigue, thinning hair, anxiety, adrenal gland issues, blood sugar inconsistencies, all of which zap your energy. The list goes on and on. What do all of these things have in common? They all feed the inflammatory response connected to your lower back condition, which slows down healing. Have you ever had days where your back pain is worse than others? While the weather was the same, you did nothing different. There seemed to be no rhyme or reason why your back hurt worse. Well, that's the inflammation response from your abnormal metabolic function. We'll be going over this in your evaluation process, and the doctor will talk to you if you're a candidate. This comes directly from our patients. If you've ever been told there's nothing else that can be done, You just have to live with it. Well, we're here to tell you today that that is absolutely not true. Once you start addressing the underlying cause of the condition and fixing it, the body knows exactly how to repair itself and start enjoying life again. The doctor you've chosen today has made the choice to address the underlying cause of your spinal problems so you can have long-lasting results, not the reset the check engine light approach. Now that you understand all the components of your spinal condition, you should be excited. We have a plan that works, most importantly. Once the practitioner meets with you, they'll determine which components you may have working against you with your degenerative spinal condition. We restore spinal function by addressing the cause of the spinal condition. We take a comprehensive approach to treating back pain, sciatica, and stenosis, and we feel strongly that the best outcomes are as a result of addressing the cause of the condition. A critical and unique part of our treatment plan involves a series of comprehensive treatments that put the body back into an optimal position to heal itself. The body knows exactly how to heal itself. Sometimes it just needs a little help. We go out and look for the newest cutting-edge technology and research to treat spinal degeneration. We found that if you attack back pain and degeneration from every angle and leave no stone unturned, that 85 to 90% of our patients get results and get better. So let's revisit the spinal anatomy and the degenerative process. Looking at an ideal spine looks like allowing the nerves to fully function. If our problems are compression of the spine, narrowing of the nerve canals, while decreasing movement of the spine affecting the nerves, wouldn't it make sense to decompress the spine and rehydrate the discs, allowing the nerves to function again that run down to the arms or legs or to our organs? Seems pretty simple, right? Well, it is. When we think about taking a medication, receiving an injection, or even going in and putting metal rods or cages into our spine to keep the nerve canals open, it's apparent that this is the wrong path to take. So, let's cover what is going to get you healthy again. Back pain, stenosis, and sciatica are conditions that require treatment of all damaged areas. Fortunately, we found that a 3-part therapy regimen has shown great results for our patients. By doing these in sync, we can correct the condition. We are using a cutting-edge technique called disc rehydration therapy. With disc rehydration therapy, we're creating motion directly to the areas of the spine that are causing nerve compression. With this motion, we're creating hydration of the disc, endorphins for pain reduction, and increased sustained motion of the spine to reverse the aging process of the spine through traction and decompression. This is a crucial part of the treatment program to restore function back into the disc and the spine, taking pressure off the nerve, controlling your vital organs and tissues. In addition, we use something called low-level light therapy or laser therapy. Low-level light therapy stimulates a process called angiogenesis, which is the naturally occurring creation of new micro blood vessels around damaged areas, which are exactly what they need to heal. Angiogenesis happens when the body produces vasoendothelial growth factor, or VEGF. Low-level light therapy stimulates your body's natural production of VEGF, leading to angiogenesis. There are thousands of studies that support the efficacy and safety of light therapy. Light therapy reduces pain, improves the function of the immune system, accelerates healing, speeds healing of fractures, increases the production of DNA and collagen, the building blocks of tissues, and increases the activity of fibroblasts for tissue repair. Low-level light therapy has been FDA approved for treatment since 2001. Our next step would be nerve and muscle re-education. When nerves have been compressed and muscles have become weak, they forget how to work properly, so we have to retrain them back to normal. We use an FDA-cleared device that sends signals to the muscle and the nerves, helping shut off the pain signals produced by the brain and allowing inflammation to decrease. This helps increase function of the muscle, retrains the nerves back to normal, and helps decrease the degeneration process overall. Your spine and your brain are communicating with each other constantly. This device is going to help retrain that crucial communication to facilitate recovery. We speak the language of nerves. Our disc rehydration therapy restores movement in the spine. Our low-level light therapy, or laser treatment, uses healing light and pulsed infrared energy to provide safe, non-invasive relief for spinal pain symptoms. And our cutting-edge digital electrotherapeutic stimulation helps nerves and joints stop hurting and begin to function normally again. The third component of our program is the metabolic component. In order for the joints and tissues to fully repair, we have to address our body's internal inflammation levels, blood flow to the damaged areas, and excess stress on our body and our joints. From the comfort of your own home or on the run, you can learn from our digital lifestyle guidance system how to adjust your lifestyle toward full recovery. Your practitioner will choose which protocol is right for you and customize it to your specific condition. Lastly, we will address the stability and flexibility of your spine by restoring, repairing, and rebuilding the muscles, ligaments, and tissues in the affected area through our digital home therapy and health education system. These are very easy and light movements you can do at the comfort of your own home through our automated home therapy service. Back pain, sciatica, and stenosis need a comprehensive approach. They cannot be treated with just a medication or a surgery. Because there are so many factors that can contribute to low back pain, stenosis, or sciatica, a comprehensive approach is needed to treat them. These therapies often include disc rehydration to increase movement, electrotherapy to retrain joints, nerves, and muscles back to health, laser or infrared therapy to stimulate angiogenesis and tissue healing, metabolic health, and our home rehab and education. Addressing spinal problems at all angles of care will help you have a long-lasting and speedy recovery. So who should come to see us? Well, it's really very simple. If you have the symptoms of back pain, sciatica, or stenosis, come see us. It would be silly not to go through our process and see if we can help you. If you have spinal pain, stenosis, instability, sciatica, sharp electric pains, if it hurts to walk, if you can't be active anymore, if you're having trouble sleeping because of back pain, or if you're afraid you might need surgery, come see us and let's find out if we can help you. We look for two types of patients that we accept into our program. Type 1 is people that are all in with their health. They value their health, they want to live longer and healthier to be with their family, they want to be productive, perform their best in life, and just generally want to thrive in life and with their health. Type 2 are exactly the same as patient type 1, but they might fall off the wagon here and there. But that's okay because our team is here to help you, support you, and get you back on track. Who should not come in to see us for an evaluation? Well, if you're looking for a quick fix, or if you don't want to take the time to invest into your health, then you would not be a good match for us. We are looking for people who want to be active participants in their health. Patient type 3 usually wants to just stay in that reactive care model, using pain medications to treat their symptoms, but not addressing the underlying cause. That's okay to make those decisions, but we find that these patients are not going to be good candidates for our program. We are extremely confident and competent in what we do. We don't take recommendations from outside sources. We're looking for people that want to make a commitment to their health. You're going to have to meet us more than halfway because it's your health. We have the program and the tools to get you better. We will be there along the way to support you. And as long as you're willing to make that commitment to yourself and your health, you can expect results. Spinal degenerative conditions get worse over time. That's why waiting to take action is not the best decision. So why not take action now? What is your motivation? Your motivation becomes our motivation in this process. So we'd like to ask you to think about that. Is it that you want to be active without pain? Maybe you want to play with your kids or your grandkids, or be able to take a walk around the block? Or maybe you're aware of the downfalls and risks of surgery down the road. This next video makes it really clear that there are two paths we can go on with our health. It's a perfect description of where life can go. We just want you to know that we are here for you, and you are in great hands with the practitioners who are using this program.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? With vitality, or get old with disease?
healthcare associate will be with you shortly.